After a long wait, finally, NEET PG exam is over for the year of 2025. The student who appeared in NEET PG, now they all have query regarding the admission process, counseling process, and different college information, fees, etc. In this regards, I want to give you the complete information regarding our paid counseling services for PG medical admission. In this video, I am giving you information regarding the paid counseling services by Careermudhra. What kind of services we provide, why the service is important for all the students, you will be getting the complete information. When a student approach to us, maybe over phone or he can walk into our office also, first we understand what if the result has not been published in that time. First we understand that how much score the student is expecting from the NEET PG exam. From that particular score, we get an idea about the expected rank of the student based on the previous year's trend. Let's say if the rank we are expecting, that is rank X. Okay. Now, after that, we ask them that what specialization the student is looking for, like what branch the student is looking for. For example, if a student is looking for general medicine, okay, then we tell the student, if the student is particularly looking for government college, okay, then we tell the student that according to his rank, whether the government college or DMB chances is there or not. If we feel the chance is there to get the seat based on the rank, then we associate the student with our paid counseling services. If the student's rank is beyond the range of getting a government college or DNB, in that case, we tell the student that in your rank, if you are looking for that particular branch, your budget should be approximately this range. Because in private college, budget is also a criteria. Now, if the student is telling, yes, sir, I am okay with that particular budget, then we take the student in our counseling process. So what I told you till now, this is the screening process what we do before associating a candidate in our paid counseling services. Once we take the student in our paid counseling services, then after what we do? Once a student associate with us in a paid counseling services, then first we ask them that within the branch what he or she is looking for, what is the priority 1, priority 2, priority 3, priority 4, priority 5, what the branches the student is looking for. If this, it might happen the student is only looking for one specialization, maybe radiology. It may happen the student's first specialization is OBG, second specialization is general surgery, third specialization is ophthalmology, fourth specialization is ENT, and there could be having number 5 specialization. So it depends on the student to student. So first we understand what specialization the student is looking for. Second, rank. We already got an idea. If a student associates with us before the result, we get an idea what kind of rank the student will be having. If the student associates with us after the result, then the rank will be getting. So the rank is the number 2, number 1, number 2. Number 3, we understand the candidate's domicility, because domicile things having advantage of different state. So what is the domicile state of the particular candidate? Number 4, which state the candidate has done the MBBS. There are many states, they give the state quota advantage based on the MBBS in that particular state. So that is number 4. Number 5 is the approximate budget. Okay, approximate budget what the candidate is having. So this kind of information first we take that from the candidate, to make the proper strategy for the candidate. This we do once a student enrolled in our paid counseling services. So from there, what informations we got might be, we have listed out according to the candidate expected rank or candidate's rank, and the candidate required specialization, candidate approximate budget, domicile, all criteria. We have to do the process maybe in 4 states. Okay, I can give an example. Maybe the candidate has done MBBS from Maharashtra, let's say. So he will be coming under the Maharashtra state quota. So we'll do Maharashtra state counseling. Maybe based on his requirement, we'll be doing the process even in Karnataka also. Okay. Then we'll be doing in the MCC counseling also. And we'll be doing for Uttar Pradesh state counseling also for the safer side. Maybe according to the candidates' details, what we got, we have finalized, we'll be doing process in this 4 states. Next, what will be the process? For participating in the counseling in these 4 states, first we tell the candidate which all documents are required, because without the document, you will not able to participate in the counseling. So we inform the candidates, for participating in this state, you need to have this document. So if you don't have, then you prepare the document immediately, so you will able to participate in the counseling. So document part is ready. Next, according to the candidate expected rank, what college he can expect based on his required specializations. If it is Maharashtra, if he is not getting government college, he is getting private college, then what will be the possibility of the private college? Which college the candidate get? Now let's say if the candidate is getting, having a possibility to get 5 colleges. Within the 5 colleges, what will be the priority order? So all these things we make ready before the counseling process starts. If a student is applying in MCC counseling, then what will be the order of colleges based on his possibility of getting the seat? For example, if I tell you, suppose if a student is having, let's say, in 20,000 rank, if he is looking for general medicine, he will not be getting in government college or DNB if he is coming under the general category. So what will be the next step? In deemed university, then in the deemed university, maybe he will be getting the seat in Maharashtra deemed university, few Karnataka deemed university. Okay, so which all deemed university he will be getting? First, we will list out that, then we will make the proper order of those colleges. So what I told you, first, based on the candidates' details, we chalk out the which all area we have to do the counseling. Then we tell them what document is required, so they can keep all the documents ready. After that, we make a list within that state counseling which college the student can get, and we make the order according to the standard of college, according to the fees, according to some other criteria, with both side consent. Like it is the consent from our side, consent from the student side. We always take the students' point also, because many student is having different kind of criteria. Location is also one important criteria for the student. Connectivity is also important criteria for students. So based on that, we list out the college of different states, like if it is Maharashtra, Karnataka, MCC counseling, UP counseling, like that. Most of the time, we keep a backup state also, because we don't know what will be the trend in this year. For that, what we do, okay, we know that maybe in these 2 states or 3 states, your allotment is very high, but we also keep a backup counseling state. So in case if anything does not happen or anything does not go based on the plan, okay, due to different reasons, so at least one state we should be enrolling where you will get the seat for 100%. Please mind it, we take a candidate if we feel that candidate is having very high chance of getting the seat. Now, once this strategy and once this primary research work has done, then once the counseling process starts, we do the counseling registrations on behalf of the student. Some cases student wants to do by themselves. If they want to do by themselves, that is absolutely okay. But this service is also available from our side. We do the enrollment, everything for the different state counseling, including Karnataka, including Maharashtra, in all the states where you will be having the possibility. Enrollment, documentations uploading, then we'll send you the payment details, all these things. Many times the student even asks that, sir, when you will be enrolling, you will be giving our number or email ID or not? Yes, definitely we'll be giving your number only. Okay, all the places your credential only will be there, and once you will be giving consent of the submission of the form, then only will be submitting the form. Okay, so everything will be having the process will be continuing based on the both side supervisions. So once the application part is done, then the choice filling will do. Okay, in this choice filling process, what colleges order will be giving, we have already made the preparation for that, as I told you. So we'll be adding those choices in the choice filling. Once we added those colleges in the choice filling places, then after some states we have to log the choice. After that, we can take the PDF of that, so it will be recorded. We will be having a record of which all places we have applied. See, regarding the college selections, college order, they will be having many discussions with the student based on different kind of criteria. Suppose if a student is looking for surgical branches, so the colleges where the surgical exposure is good, surgical particular beds, number of bed is good. So based on different discussion, different criteria, we figure out the order of the colleges, patient flow. Some cases we consider the stipend also in different colleges. There are many deemed university who is having even the stipend is 70, 80,000 per month. So we consider some private colleges, they don't give even stipend also. So all these things we consider in the counseling choice filling process. So once the choice filling is done or choice blocking is done, after that the allotment will be happen. After allotment, we analyze the standard of the allotment. Suppose if you have got a college where we feel that this is the best options what you got. So we tell the candidate to complete the admission process. If we feel that the college what you got that may not be your best choice, but according to the trend, you should not leave that particular options. Example, suppose if you have got, if your rank is 25,000, okay, you have got general medicine in a college called DY Patil, or the fee structure is little high. Now, might be you might be thinking, okay, their fees is high, so whether I should take or not. But it has to be decided based on some analysis. If your rank is 25,000, okay, and the DY Patil cutoff is 26,000. 27,000, then there is a very less possibility that college you will get in the round 2. In that case, you should not leave that particular opportunity. So all analysis will do after the allotment of your college. Once your allotment is done, then we'll tell you, okay, you take admissions. Round 2, we will try for the upgradations, better college upgradation. Again, in the round 2, based on the seat matrix, we will do the choices, and you will be getting chance for upgradation till round 3 in MCC and most of the states in round 2. Once your admission entire process has done, then you'll be joining in your college and you will start your residency in the college. Once you join in your college, our job will be over in that point of time. So once a student associate with us till the student join in the college, this entire journey will be with the student, and step by step all the information which is required and relevant for the counseling process and which is relevant for that particular student's rank and requirement will be providing the entire details. Student, this is a brief what I shared with you, but once a student associate with us, then there will be having many layer of discussions in different angle also. So that will be, when you'll be associating with us, we'll tell you that which all things we should consider before joining the college. Give an example, you must be knowing in PG, toxicity level is also a matter of considerations for different college. So those things also you might have to consider in future. So hope you understood about our counseling services, more precisely paid counseling services process. If you are looking for paid counseling services, you can contact us in this number. The same way what I explained you in this video, the same way we'll guide you. Good luck.